We'll start off by drawing a really stylized scapula. So we'll draw this little weird trapezoid here with a small rectangular block in the middle. What we're showing here are a couple dashed lines that are going to be the start and end points of the axillary artery, so they make a good landmark. This view of the scapula is from the posterior side, so this is a right scapula. Let's do some labeling just to keep ourselves oriented. Up at the top, our first dashed line represents the clavicle. Our second represents the teres major muscle. Over on the side here, this is the medial border of the scapula, and at the bottom, that's the inferior angle of the scapula. And our weird rectangular in the middle is the scapular spine, also known as the spine of the scapula. That spine does extend superiorly, but we've cut it off here to make it simple. And then over on the lateral side is where the humerus would sit. Okay, now we're ready for some arteries. We're going to draw one big line going around the superior and lateral side of the scapula. This starts out as the subclavian artery all the way up until it crosses the clavicle. After it passes the clavicle, it changes names to the axillary artery because it's occupying the armpit or the axilla. Once it passes teres major, it changes names one more time to the brachial artery. That axillary artery is actually going to pass anterior to the scapula, but we've blown it out here just to make it easier to see. First up are our branches of the subclavian artery. So we've got 1, 2, 3. The first one goes up, second goes down. These are the vertebral arteries and the internal thoracic artery. They don't involve the shoulder, but they're there, so let's not forget them. Our third branch here, coming down, typically actually kind of points up, but we're pointing it down to make it easier to label. This is the thyrocervical trunk. The thyrocervical trunk actually has 4 branches, 2 of which don't involve the shoulder, so I'm not going to label them. And then one that's going to come a little more inferiorly, and one that's going to go all the way across the top of the scapula, across a ligament, and then just lateral to where the scapular spine comes off of the scapula. This long branch is the suprascapular artery, and the one pointing down is the transverse cervical artery, also sometimes known as the cervico-dorsal trunk. The transverse cervical artery is going to split into 2. That first one's superficial cervical artery. The second one goes around the medial border of the scapula, and that is the dorsal scapular artery. Next up are the branches of the axillary artery. Some of these I'm going to cover pretty briefly. So first, 1, 2, with 4 branches, and 3. That first branch is the superior thoracic artery. Our second branch is the thoracoacromial artery. And our third branch is the lateral thoracic artery. Past that, we have 2 arteries that are going to go on either side of the surgical neck of the humerus. So these are the circumflex humeral arteries. There's an anterior one and a posterior one. These arteries sometimes have a common trunk, or sometimes will come off of that axillary artery separately. Our final branch of the axillary artery is the subscapular artery. We're going to cover this one in more detail in just a moment. The final branch we're drawing here, just off of the brachial artery, is the deep brachial artery, also known as profunda brachii. Our subscapular artery is going to split into 2 branches, one coming up and one going towards the inferior angle. That branch coming up is the circumflex scapular artery, and that branch coming across is the thoracodorsal artery. These 2 arteries are going to anastomose with the arteries coming from the thyrocervical trunk. So we have collateral blood flow running from the dorsal scapular artery to the thoracodorsal artery back to subscapular, or we can also have collateral blood flow from suprascapular artery to the circumflex scapular artery and to subscapular again. But most blood will flow from subclavian to axillary to brachial.